Evening everyone. My name is Kausar Jasmine from Mechanical Second Year. Today my topic is about climate change and its effects on public health. Climate change and its effects on public health. Introduction to climate change and public health. Climate change refers to long-term alterations in temperature, precipitation and other atmospheric conditions. It possesses significant risk to various aspects of human health and well being. Understanding these effects is crucial for developing effective public health strategies. Overview of climate change. Climate change is primarily driven by human activities such as burning fossil fuels and deforestation. It leads to increased concentrations of greenhouse gases in the atmosphere. These changes result in global warming and altered weather patterns. Rising temperature. Global temperature have risen significantly over the past century. This increase leads to heat-related illness, existing health conditions. Vulnerable populations such as the elderly and children are particularly at risk. Air quality impacts. Climate changes affects air quality by increasing the frequency of wildfires and smog. Poor air quality is linked to respiratory diseases, cardiovascular problems, and premature death. Urban areas are especially vulnerable to air pollution by rising temperatures. Quality and availability. Climate change impacts the availability and quality of freshwater resources. Increased rainfall and flooding can lead to contamination of drinking water supplies. Waterborne diseases such as cholera and gradius can become more prevalent as a result. Vector-borne diseases. Climate change influences the distribution and behavior of disease vectors like mosquitoes and ticks. Warmer temperature and changing precipitation patterns can expand the habitats of these vectors. Diseases such as malaria, dengue fever, and Lyme disease may become more widespread. Food security and nutrition. Climate change affects agricultural productivity and food system globally. Extreme weather events can damage crops and lead to food shortages. Malnutrition and foodborne illness may increase as a result of compromised food security. Mental health effects. The stress and anxiety associated with the climate change can have significant mental health impacts. Naturally, disasters or displacement can lead to long-term physiology trauma. Vulnerable populations may experience heightened levels of depression and anxiety disorders. Extreme weather events. Climate change is linked to the increasing frequency and severity of extreme weather events. Events such as hurricanes, floods, and drought can result in injuries and loss of health. These disasters can disrupt healthcare system and access to medical services. Health disparities and vulnerable population. Climate changes exacerbates existing health disparities among marginalized communities. Low income populations often face greater exposure and fewer resources to adapt. Addressing these disparities it vital for equitable public health response. Economic impact on health. The economic burden of climate related health issues can strain public health system. Increased healthcare costs associated with treating climate related illness are expected to rise. Investing in preventative measures can help mitigate this economic impact. Policy response and adaptation. Effective policies are essential for mitigating the health impacts of climate change. Public health agencies must integrate climate conditions considerations into their planning and response efforts. Community engagement and education play virtual role in building resilience. Global health initiatives. International collaborations aim to address the health implications of climate change. Initiatives such as the Paris Agreement emphasizes the need for collective action. Global health organizations are working to develop frameworks for climate resilience. Role of healthcare providers. Healthcare providers play a critical role in addressing climate related health issues. They can advocate for policies that promote sustainability and health equity. Training healthcare professionals for climate related health impacts is essential for preparedness. Community engagement and education. Community involvement is crucial in addressing the health effects of climate change. Public education combined can increase awareness of climate related health risks. Empowering communities to take action can foster resilience and adaptation. Research and data collection. Ongoing research is necessary to understand the complex relationship between climate change and health. Data collection on health outcomes related to climate change is necessary for effectively policy making. Collaboration between researchers, public health officials, and policymakers is vital. Sustainable practices for health. Promoting sustainable practices can contribute to both environment and public health. Transitioning of renewable energy source, reducing greenhouse gas emissions and improves air quality. Encouraging active transport and green spaces can enhance community health and resilience. Case study and success stories. Examining successful interventions can provide valuable lessons for public health response. Case studies highlight effective adaptation strategies implemented in various communities. Sharing experience can inspire further action and enhance resilience effort. Future directions and innovations. Innovative approaches are needed to address the evolving challenges posed by climate change. Technological advertisements can aid in monitoring and mitigating health risks. Collaborative efforts across sectors will be essential for creating comprehensive solutions. Conclusion and call to action. Climate changes poses significant threats to public health that require urgent attention. Collective action is essential to mitigate these impacts and protect the vulnerable populations. Engaging in sustainable practices can contribute to a healthier for, future for all. Thank you and have a nice day.